Hey everybody, talking a little bit more about when your patient may need a second opinion for ingrown toenails. And really it's all about sort of what you're seeing there and how urgent or acute it might be. Often we can undertake sort of a more conservative option and then provide a surgical option as well. But for those that have had failure of consistent treatment, they've got recurrent ingrown toenail pain with or without an infection, it's more likely that a second opinion for either further conservative or a surgical option could be a good way to go. Often in patients that have got a family history of ingrown toenails due to a number of different things, it could be that we go, okay, well, yes, there's several here that are of concern. It's more likely this is to be continuing to happen prolonged throughout their life. Let's be proactive in managing this now whilst they're in a healthy position and putting in place a surgical option there. For patients that have got really thick dystrophic fungal toenails, that complicates their simple, what would otherwise be a simple ingrown toenail. A second opinion might be sought for different procedures that may be available to really make sure that the patient does have a good outcome that's longer lasting and definitely more likely to work, because the fungal side can interact and cause some complications, and making sure that we get that reduced recurrence rate is really important. If they have had a previous procedure that has failed, definitely consider referral for a higher level procedure to make sure that there's no scarring, nail spicule, or abscesses that are present within that sulci or nail edge, just to make sure that we're giving them the best outcome. And definitely if there has been infection present and it's not resolving, consider osteomyelitis so that we can make sure our patients are safe. And in that position, you're definitely going to be looking at an X-ray if it's longer term, but otherwise maybe a CT or MRI to definitively exclude any osteomyelitis or bone infection that may have occurred due to a previous procedure in that area. But hopefully this has given you a little bit of further information on when a patient may need a second opinion for ingrown toenails. Hit the subscribe button to see a lot more. Otherwise, we've got the videos there for different conditions, and we'll see you in the next session. Cheers.